Text USCF Health, UCSF Benioff Children's Hospitals, preparing for surgery. Animated medical practitioners wave in front of the hospital building.
Welcome to UCSF Benioff Children's Hospital in San Francisco. My name is Kate, a member of the Benioff Children's Hospital Youth Advisory Council, and I will be your guide.
An arrow points to the entrance of the hospital. Kate guides a mother and daughter down a hallway inside.
This is the front of the hospital where you and your family will enter. The address is 1975 4th Street. Now I'm going to show you some of the places you may see and things you may do on your day of surgery.
Kate stands in front of the areas of the hospital as she names them. The walls are painted with colorful images.
This is the lobby. After walking in, you will check in here. Then you will go to the elevators to take you to the second floor. This is the surgical waiting area. You will check in at the surgery check-in desk to let your doctors and nurses know you are here.
A message pops up on a phone.
They will also ask for a cell phone number to keep your family updated on your surgery. There are lots of places to hang out while you're waiting. You can bring something from home to help pass the time.
A doctor waves in a hallway, then leads the patient down the hall.
When the doctors and nurses are ready for you, someone will escort you and your family to the first of 3 rooms you will be visiting, called the pre-op area, where you will meet your surgery team. You will walk down a very long hallway past the tall grass to get there. The pre-op area is very big and busy. You will be taken to your own room. This is where you will change out of your clothes into a special hospital gown and socks.
The gown and socks sit on a bed.
You can choose to close the curtain for privacy at any time. You can pick an activity to do while you wait.
A colorful striped curtain closes around Tay-bed.
You can choose to sit or lie on the bed or sit in a chair.
Medical items sit near a table.
These are some of the items the nurses will put on your finger, touch to your forehead, or put your arm to check your breathing, your temperature, and your heart rate. Nothing should hurt, but they may feel cold or will squeeze your arm. You may hear beeping noises while the machine checks you. Nothing is done to you without you knowing. The nurse will ask you and your family a lot of questions before surgery. They are all to make sure that they have all the important information they need. A lot of other people will want to talk to you or your family while you're waiting. There are many jobs in the hospital and lots of them are on your surgery team and they want to meet you. There could be an interpreter if you choose to listen or speak in another language.
The medical staff wave.
The surgery team will come in and check with you about the plan for the day. They may also write on your body to remind everyone about the correct side of your body for surgery. During your surgery, you will go to sleep with medicine called anesthesia. The provider will share the plan of how to keep you asleep during surgery and keep you safe. The nurse who will be with you in the surgery is the OR nurse and will also say hi and check about the plan.
A tablet, book, and teddy bear appear.
You can bring your comfort item from home to take into surgery with you. Listening with headphones helps if you don't want to hear stuff. That helped a lot for me. When it is time for your surgery, you will go to the next area of your visit, the operating room.
A nurse wheels the patient on a bed.
You can ride on a bed or walk down the long hallway to your room. If someone from your family is coming with you, they will walk together with the doctor or a nurse.
The operating room is filled with equipment.
It's a lot brighter and colder in the operating room than the pre-op area, with a lot of equipment and machines. I like to remind myself that they are not all there just for me. You will hear the anesthesia machine beeping.
The medical staff surround the patient's bed.
There are a lot of people in the room, and you will see a lot of the same people you met in the pre-op area here in the operating room. If you have any questions about your surgery or anything you see, you can ask them. This is the time that you will go to sleep, and they will make sure you are safe. There are different ways to fall asleep for surgery.
Plastic masks appear.
These are masks that go over your nose and mouth that send medicine that you breathe to make your body fall asleep. It feels squishy on your face, and it smells like plastic, but they have different smells you can pick to make it smell good.
An orange, apple, candy, and lemon appear.
These are just some examples.
A woman holds a thin, flexible IV catheter.
If you're older, there will be an IV catheter in your arm, which is a plastic straw that helps to get medicine into your body through your veins to make your body fall asleep. After your body is asleep, if someone came with you to surgery, someone will guide them back to the waiting area so you'll know where they are during surgery. and they will know where you are. They will get text messages on their phone for updates. There is also a screen in the waiting area that will keep your family updated. During your surgery, it will feel like you were asleep for a few seconds. After surgery is over, they will stop the medicine and you will wake up in the third area, the recovery room. When you wake up, you will feel and see stickers and monitors on things on your body, but none of them should be hurting you. These are some of the same items that you saw earlier to make sure your body is safe.
The patient sleeps in the recovery room.
Tell the nurses how your body is doing. If you're still feeling sleepy, you can take a regular nap here. Our plan is to have your family next to you when you wake up, but if they aren't there yet, they are on their way.
The doctor and family members stand around the patient's bed.
One of your jobs in recovery is to let the nurse and your family know how you feel and how your body feels. If your body is hurting, let your nurse or family know so they can make a plan to make it better. Like if your throat hurts, let the nurse know. They might ask you to drink something before you leave the wake-up area. You can pick water, juice, or a popsicle. If you need to wait longer to drink, the nurse will let you know.
A nurse wheels the patient in a wheelchair.
When the doctors and nurses are done helping your body, they will remove all the monitors. If you will be staying overnight in the hospital, someone will bring you to your new room. If you are going home, you will put on your regular clothes, and the nurse will either help you into a wheelchair or your family will carry you to the front of the hospital to go home. I hope this helped you be a little more prepared for surgery. If you thought of some questions, write them down and bring them with you so you can ask your doctor or nurse. Bye!
Text. For further support, preparing your or your child, please contact Child Life Services. Child Life Services at ucsf.edu, www.ucsf.benioffchildrens.org/services/child-life.